In order for new medications to develop so that we can all feel better and live longer, clinical trials with volunteers just like you at home are super important. So that's exactly why I've come out to Noble Clinical Research to talk to Dena Petersen. Doctor, thank you so much for having us.
Thank you for coming out, Tina.
Well, I really want to kind of find questions that I think people might have and ask them so we can kind of maybe break some myths and get some people some information. First thing is, what is it that you and your staff do?
We conduct research studies on new medications to make sure they're safe and effective before they receive FDA approval to become available to the public.
Well, that's an easy way to kind of explain what you do. And I'm sure you probably get the question, we have so many medications that are out there. Why do we need new ones?
In 20 years as a family doctor, I've learned that not all medicines work for all people. Similarly, often more than one medicine is needed to treat a problem. But with the right combination of treatments, people really can feel better and live longer.
Which is, of course, what we all want. So with that being said, what are some of the kinds of medications that you guys research here?
For many health problems in both men and women, including arthritis, knee pain, urinary problems, back pain, constipation, diabetes, influenza. Of course, we're not studying all these medications at any one time. We have several volunteers who call often to see if we might have a study that's right for them. I'm sure you realize, Tina, that chronic medical problems really can impact a person's quality of life. With arthritis knee pain, for example, everything hurts. Hiking, getting in and out of the car, even walking can be a struggle. We're working on a study right now that looks really promising, so the more people we get on study, the sooner the treatment can become available to the public. Similarly, we have two studies specific to women, one for heavy menstrual bleeding in women with fibroids, another for pelvic pain in women with endometriosis. Women who qualify for these studies receive quite a bit of free medical care, including free contraception, even free feminine hygiene products.
So now we know some of the things that come along with being a volunteer. Kind of explain a little bit more about that experience, what it would be like if we came in.
Before a subject comes in for an appointment, my staff spends quite a bit of time on the phone asking them a number of questions to see if they might be a good fit. If they seem like they might be a good fit, we bring them in for an appointment where they read a thorough explanation of the study, and then we ask them questions about their medical history. At this appointment, there's usually a physical exam, laboratory work, EKG, and afterward there may be some simple testing such as an X-ray or an ultrasound. If they qualify for the study, then my staff teaches them how to use an electronic diary to capture their experiences on study. Then there are more appointments and oftentimes telephone calls. Of course, all the testing is free to them, so even if they don't qualify, they often derive benefit from testing.
Well, what I'm hearing through everything that you're saying is that you walk us through everything, hold our hand, make sure we're comfortable. And I know probably another big question that you receive is, do I have to pay to be a part of the study?
No, Tina, in fact, the opposite is true. Volunteers are paid for their time and travel efforts between $500 and $2,500 depending on the study. More importantly, they have the satisfaction of knowing that they're helping to advance medicine. I tell volunteers without people like them, we wouldn't have any medicines today. It's a tremendous gift that they give.
So, Doctor, can I say that since I've walked in, your staff has been absolutely amazing. But I do have to ask you, I have a feeling I already know the answer, but do you love what it is that you do?
Tina, I love my work. I love knowing that our efforts are helping people. As a family doctor, I can help one person at a time, but in my research efforts, I can help hundreds, if not thousands of people. And volunteers should feel the same way. Their efforts help many, many people all over the world.
Well, which is the bigger picture of everything. And I really do think that we have covered a lot, and I think a lot of things that people had questions about. So I can't wait for someone to come out and, like you said, be a part of such big things that are going on in medicine.
Thanks for your time, Tina.
Oh, absolutely. Now, to learn more about participating in a clinical trial, call Noble Clinical Research. They're at 520-612-7860 or go online to nobleclinicalresearch.com.